Hello, my name is Christina Del Toro, and this is my project on reducing hip pain and instability in pregnancy. My research question is, will the incorporation of the exercises pelvic floor squeezes, abdominal bracing, as well as adduction exercises decrease pelvic and SI joint pain as well as instability in pregnancy? So for this project, I didn't have any comparison to go off of, even though I did have a pregnancy before, and I also experienced hip pain and instability there. I didn't have any data to really reflect on. So I started this project with a control week where I didn't have any exercises that I was doing, and I just tracked the same way I tracked throughout the entire project. And the way I did track was with two quantitative measurements. The first one was off of a normal pain scale, how much pain I was getting in my pelvic area, as well as SI joint clanks, how many clanks I would actually feel or hear a day. And that was very easy for me to identify because even after pregnancy, I would experience that quite often. Some considerations that I had with this project is throughout pregnancy, it obviously gets, a little bit more challenging. So I didn't know if I was going to see any improvements at all because I was just going to progress in the pregnancy. So Monday through Friday, I was very religious in doing these exercises in the morning. It took me a while to get in the rhythm of it, trying to figure out morning, night, when to really squeeze this in. But the three exercises that I did were abdominal bracing, 5 sets of 15 second holds, pelvic floor squeezes, 10 sets of 10-second holds, and hip adduction, 10 sets of 10-second holds as well. Pelvic floor squeezes, also known as Kegels, and I did start off doing the abdominal bracing exercises similar to the way it's presented just on the floor. About mid-semester, I kind of moved to the bed, and then from the bed I moved sitting upright into a yoga ball because it was just getting very difficult to move in and out of that position. So evidence that I was basing where I really came up with which exercises I wanted to use was based off a study conducted by Dr. Mehta in 2022. She wanted to find out the effects of exercises in patients with sacroiliac joint dysfunction. She states that pelvic girdle pain represents a group of musculoskeletal pain disorders associated with the sacroiliac joint. The endurance capacity for standing, walking, and sitting is diminished, and turning over in bed is difficult and painful. So for me, I would say from beginning to end, I've always had this issue with turning over in bed. I wasn't as concerned with the bed portion of it rather than really comparing how I felt throughout the day, even though I did track all of it. I was mostly focusing on how I felt throughout the day. It also says here that the weakness of hip extensors, pelvic floor muscles, and transverse abdominal muscles are associated with pelvic girdle pain. The idea is that by strengthening these muscles, it will lead to a reduction in pain. So because of those, I included the exercises I did. So I did put a picture of a roller coaster on here because I felt like I had a love-hate relationship with this project. The discipline aspect of it was a little challenging, just being strict on yourself and making sure you do these exercises like you say you are. And with the results that I found, I did find very surprising results. In the very beginning, I wasn't as pregnant, obviously, but I was having such bad pain in my pelvic area. I was having clanks in my SI joint all the time. By about mid-semester, I was noticing very limited and reduced SI joint clanks. I was still getting pelvic pain, and there was actually a huge peak where I was wearing my SI joint belt, which is kind of just similar, exactly like that one there. And only when I was wearing that is when I wouldn't get any pain. And then it kind of just started going down with my pain and the SI joint clanks. So even now I'm as pregnant as I have been, and I have no pain. I only get the SI joint clanks and really the pain if I'm laying in bed. So not walking is when I was really looking for that. It's when I was like throughout the day. Just to conclude this project, I do believe that the incorporations of exercises like pelvic floor squeezes, adduction exercises, and abdominal bracing, it can in fact reduce hip pain and instability in pregnancy.